If you're watching this video, chances are you have tried tablets, physiotherapy, maybe even injections, and your knee still hurts. I want to tell you something today that most people have never heard. Your knee is not failing because it is old. It is failing because it is overwhelmed. And unless we understand what is overwhelming it, nothing you try will give you lasting relief. Let me show you the 3 real reasons a knee refuses to heal. Reason 1: chemical attack. Inside every arthritic knee, there is a storm of chemicals that you cannot see on an X-ray. Inflammatory molecules, proteases, enzymes that behave like tiny scissors cutting cartilage. This is why many patients say, "Doctor, my X-ray looks okay, but my pain is severe." The chemical attack is worse than the wear and tear. Reason 2: mechanical overload. Most knees don't wear out suddenly, they wear out unevenly. If your alignment is even a little off, a few degrees of varus or tilting in the kneecap, the load becomes concentrated on a single zone. That zone starts to crack while the rest of the joint looks normal. Your MRI shows the damage, your X-ray shows nothing. This mismatch confuses doctors and frustrates patients. Reason 3: biology cannot work in a hostile joint. This is the one secret that changes everything. Your knee is a biological organ, not a mechanical hinge. Muscles, nerves, cartilage, synovial lining, all of them communicate through chemical signals. But once the joint is inflamed, swollen, acidic, and filled with destructive enzymes, those signals shut down. Even the best physiotherapy cannot work in a hostile joint environment. The soil is wrong, so nothing grows. So what do? The first step is not to inject something into the knee. The first step is to fix the environment so the knee can finally heal. This is what modern biologic and mechanobiologic treatments do. They don't just chase pain, they reset the environment so your joint can start repairing from the inside. In the coming weeks, I will explain each layer of this process: how to calm the chemical attack, how to correct the mechanical overload, and how to prepare your knee for advanced biological repair. This is the future of arthritis treatment. Not quick fixes, not random injections, but step by step reconstruction of the joint ecosystem. In conclusion, if your knee feels unpredictable, if small activities trigger swelling, if nights are painful, your knee is not weak. It is sending you a message: fix my environment and I will heal. Follow this series closely. Everything is going to make sense very soon. This is Dr. A.K. Venkatachalam from the Madras Rejuvenation Centre. Vanakkam.